Suture marks after partial incision double eyelid surgery. Hi, I had partial incision double eyelid surgery nearly 2 months ago and still have visible suture marks on downsize and when my eyes are closed. Just wondering if these will fade with time or are likely to be permanent as a result of the sutures, and if a revision could help minimize their appearance. Any comments would be much appreciated. Thanks.
Thank you for your question. You underwent partial incision Asian double eyelid surgery. It's now 2 months after surgery, and you submitted 2 photos showing the incision line, and you're concerned about the healing process, and you want to know if possibly any revision surgery would be necessary. Well, I can certainly help you with this question. I'm a board-certified cosmetic surgeon, certified by the American Board of Cosmetic Surgery, and a fellowship-trained oculofacial plastic surgeon, trained through the American Society of Ophthalmic Plastic and Reconstructive Surgery, in practice in Manhattan and Long Island for over 20 years. And Asian eyelid surgery is an area of specialty that I perform routinely. So to help you understand where you're at in this healing process, it's important to understand just normal wound healing. Wound healing goes through 3 distinctive phases that have some overlap between phases. The first phase is called the inflammatory phase, and this is that phase you probably remember where the eyelid was fairly swollen, the eyelid margin to the crease looked elevated, and it looked like the eyelid crease was too high. The places where the stitches were placed was very red, and that's the stage is mostly in the first week after surgery, and it's called the inflammatory stage. After that stage begins, or overlapping a little bit into the first month, is the proliferative stage, where the body is generating blood supply and collagen, and it's kind of an early stage of a lot of activity to repair. And then the next stage, which is the stage you're pretty much in, is called the collagen remodeling, or the wound remodeling stage. This is when the collagen that's first disorganized becomes organized and flattens and softens. So the incision lines go from being thick to flatter. So the question about at 2 months in looking at the incision, when you think about it, the wound remodeling stage, which I just described, actually can last a year to 2 years, which means that it's still early. And as far as the visibility of this crease, it's possible that you will always have some kind of line because an incision was made in the skin, but it is unlikely that you will see it'll be very obvious. Even in someone who's never had eyelid surgery, when their eyes are closed, you can often see just a subtle hint of a crease. When you do with cosmetic eyelid surgery, you try to create a natural crease so that it looks like it's always been there. So I think that you can, in your follow-ups with your doctor, you can ask your doctor the question about the way it looks. But when we see our patients, we have a schedule of when we see people after eyelid surgery. It's 1 week, and then within the next couple of weeks, and then 1 month, 3 months, 6 months, and then 12 months. It's done purposely to look at the stages of healing, and if there's ever a need for any enhancement or revision, whether there's a little bump here or there or something, we can do it at a time when it's more stable, unless it's needed, something more urgent is needed. But that's rare. It's really to enhance maybe the result, if at all. So that being said, you don't have to worry about anticipating needing some kind of revision surgery this early. From just the photographs alone, I think those incisions look great. I think you will most likely heal well. This is it's not a consultation, but at least with the photo, I can give you some guidance. Ultimately, it's you and your doctor and the 3-dimensional examination that really matter in this. But certainly, it does not look in any way unusual or atypical. So I hope that was helpful. I wish you the best of luck, and thank you for your question.